If you are experiencing urinary discomfort, frequent nighttime urination, or pressure linked to the prostate, and you want to make sure your prostate stays healthy for the coming years, then this video is for you. Many men live with these symptoms without realizing that one of the most underestimated tools for prostate comfort is something extremely simple. Today, we're going to talk about water, and why neglecting it may be one of the biggest mistakes men make when it comes to prostate health. Most men who suffer from prostate-related discomfort focus on medication, supplements, or advanced treatments. Very few stop to examine one fundamental factor: hydration. In clinical practice, many patients report urinary pain, weak flow, burning sensations, or constant pressure, yet when asked about their daily water intake, the answer is often vague, inconsistent, or clearly insufficient. This is not accidental. Water is often perceived as too basic to matter. And that is precisely the problem. Water does not advertise itself as a solution. It doesn't come in a capsule. It doesn't promise instant results. Because of this, it is frequently ignored, even though dehydration quietly worsens urinary concentration, irritates the bladder, and increases strain on the prostate. What makes this more concerning is that many men live for years with preventable irritation, never being informed that hydration directly influences urinary comfort and prostate workload. This information is rarely emphasized clearly, despite being well understood in medical physiology. I'm not saying water is a miracle cure, but I am saying this: ignoring hydration puts the prostate under unnecessary stress. And in the next section, I'll explain exactly why, at a biological level, so you understand what's really happening inside your body. From a biological standpoint, water plays a critical role in urinary and prostate function. The prostate surrounds part of the urethra, the channel that carries urine out of the body. When hydration is inadequate, urine becomes more concentrated. Concentrated urine is more acidic and more irritating to the urinary tract. This irritation increases discomfort, urgency, and inflammation-like sensations, even when no infection is present. Adequate water intake helps dilute urine, reducing its irritative effect on the urethra and bladder. This alone can significantly ease burning, pressure, and frequent urges. Water also supports proper circulation. The prostate, like any organ, depends on healthy blood flow to remove metabolic waste and maintain tissue balance. Chronic low hydration subtly reduces this efficiency over time. Additionally, hydration supports kidney filtration. When kidneys work efficiently, urinary flow becomes smoother and more regular, reducing back pressure that can aggravate prostate discomfort. Importantly, hydration does not enlarge the prostate, a common fear among men. In fact, proper hydration can reduce functional urinary strain by promoting cleaner, more consistent flow. In simple terms, water reduces irritation, supports circulation, and lowers urinary stress, all of which directly affect how the prostate feels and functions daily. Now, here's where most advice becomes vague and ineffective. Simply, drinking more water without structure can actually increase nighttime urination or discomfort. That's why the method matters. The men who report the most relief follow a timing-based approach, not random intake. They hydrate steadily during the first 2/3 of the day, allowing the urinary system to flush naturally while the body is active. They reduce intake in the evening, preventing unnecessary nighttime pressure. They also avoid long periods of dehydration followed by sudden large volumes of water, which shocks the bladder and prostate. Temperature matters too. Room temperature water is often better tolerated than very cold water, which can trigger bladder sensitivity in some men. This approach is not aggressive. It's gentle, supportive, and sustainable. And while water alone is not a medical treatment, used correctly, it can significantly reduce